Urinary tract infections in men are uncommon, and that rarity is what makes them so dangerous when they do occur. Because they're rare, they get missed. Because they get missed, they progress. And in senior men, a UTI that progresses to kidney infection or bloodstream infection can become life-threatening within 48 hours. My name is Dr. James Whitaker, board-certified urologist, and today I'm going to talk about something that I believe is genuinely underappreciated, not just by men themselves, but sometimes by the medical system. Urinary tract infections in men, and specifically in senior men, are a significantly more serious medical situation than most people realize. Let me start by explaining why male UTIs are different from female UTIs in ways that matter clinically. Women are anatomically predisposed to urinary tract infections because the female urethra is approximately 4 centimeters long, placing the bladder in close proximity to external bacterial sources. As a result, UTIs are extremely common in women, affecting roughly 50% over their lifetimes, and in otherwise healthy young women, they are generally uncomplicated infections that respond rapidly to a short course of antibiotics. Men have a urethra that is approximately 20 centimeters long, making it far more difficult for bacteria to ascend to the bladder. As a result, UTIs in young, healthy men are rare enough that when they occur in men under 40, they are considered abnormal and warrant investigation for an underlying cause. A UTI doesn't just happen in a healthy young man. Something has to make it possible. This brings me to the critical point for men over 50. As men age, several changes occur that progressively increase UTI risk. Residual urine sits in the bladder, stagnates, and becomes a culture medium for bacterial growth. The bladder muscle weakens, and the immune response of the urinary tract lining becomes less robust with age. Men who use urinary catheters, temporarily or permanently, have dramatically elevated infection risk. Men with diabetes have impaired immune responses and abnormal glucose in their urine that promotes bacterial growth. I want you to know the 5 warning signs of a UTI in men so that if you or a man you care about experiences them, action happens immediately rather than days later. Warning sign number 1, burning or pain during urination. Dysuria, the medical term, is caused by inflammation and irritation of the urethral and bladder lining from bacterial infection and the inflammatory response it provokes. It is typically described as a burning, stinging, or aching sensation that occurs during urination and sometimes persists afterward. This is the symptom most people associate with a UTI, and it should prompt evaluation the same day it occurs in a man. Warning sign number 2, increased urinary frequency and urgency. The inflamed bladder becomes hypersensitive. It signals the urge to urinate at much smaller volumes than normal, and the urge is often difficult to defer. Men describe needing to run to the bathroom urgently every 30 to 60 minutes and producing only small amounts each time. This symptom pattern, frequency plus urgency plus small volumes, is classic for bladder inflammation from infection. Warning sign number 3, cloudy, dark, or foul-smelling urine. The presence of bacteria and white blood cells in the urine changes its appearance and odor significantly. Urine that is murky, visibly turbid rather than clear, or has a distinctly unpleasant ammonia or sulfur-like smell strongly suggests infection. Sometimes blood is also present, producing pink or reddish urine, which indicates more significant bladder inflammation. Before I go further, please subscribe to this channel right now. I'm Dr. James Whitaker, and I post real, detailed medical content every single week. Hit subscribe and share this video with every man over 60 in your life. This information prevents hospitalizations. Drop a comment below telling me, have you or someone you know been hospitalized because a UTI was caught too late? I want to know. Warning sign number 4, pelvic pressure, lower abdominal discomfort, or pain in the perineum, the area between the scrotum and the anus. When a UTI involves or spreads to the prostate, a condition called prostatitis, pelvic pain becomes prominent. Men describe a deep, aching discomfort in the pelvis, sometimes radiating to the lower back or the inner thighs. Prostatitis significantly worsens the clinical picture and requires specific antibiotic therapy at appropriate doses for adequate duration, typically 4 to 6 weeks rather than the 1 to 2 weeks used for simple bladder infections. Warning sign number 5. And this is the emergency. Fever above 101 degrees Fahrenheit, shaking chills, and pain in the flank, the side of the back below the ribs on one or both sides. These symptoms indicate that the infection has ascended from the bladder through the ureters to the kidneys, causing pyelonephritis, Kidney infection. Kidney infection in senior men is a serious illness that typically requires hospitalization for intravenous antibiotics and close monitoring. If left untreated or undertreated, pyelonephritis can progress to urosepsis, bacteria in the bloodstream, which carries significant mortality risk, particularly in elderly men with other health conditions. I want to spend a specific moment on UTIs in men with cognitive impairment or dementia, because this is a population where I see dangerous delays in diagnosis regularly. Men with dementia often cannot clearly communicate urinary symptoms. Their presenting complaint for a UTI may be entirely behavioral: sudden worsening of confusion, agitation, withdrawal, hallucinations, or a dramatic change in functional status, without any obvious mention of urinary symptoms. This occurs because the systemic inflammatory response of an infection impairs brain function, and in a brain with already reduced cognitive reserve, this effect is amplified and can appear dramatic. Any sudden change in mental status in an elderly man, particularly if accompanied by any urinary symptoms at all, should prompt an immediate urine test to evaluate for infection. If symptoms are limited to burning urination, frequency, urgency, and cloudy urine without fever, contact your primary care physician or an urgent care clinic the same day. Before taking any antibiotic, ensure a urine sample for urinalysis and culture is collected, because the culture tells us which bacteria are present and which antibiotics will work. Taking antibiotics before the sample is collected can make the culture falsely negative and make targeted treatment much harder. If there is any fever, back or flank pain, shaking, chills, or the person looks or feels systemically unwell, go to an emergency room immediately. Do not drive alone. Call someone or call emergency services. In elderly men, urosepsis can progress from fever to life-threatening instability in hours. After any UTI in a man is treated and resolved, appropriate follow-up matters. A repeat urine culture should confirm the infection has cleared, and a conversation with a urologist about the predisposing cause is essential, because in men, a UTI without an identified predisposing cause should prompt evaluation of the prostate, assessment of bladder emptying with an ultrasound, and consideration of whether structural or functional factors need to be addressed to prevent recurrence. I'm Dr. James Whitaker. This video could genuinely prevent a serious medical emergency for someone you care about. Please share it. Subscribe to this channel for weekly medical content, and I will see you in the next video.